Hello everyone, Sister P here from Opulent Health and Wellness. So today we're doing our Wednesday Wellness Days, and we're kickstarting with a condition that is most common, most ignored, yet most dangerous condition. So we are talking hypertension. So hypertension is also called high blood pressure. It is when the force of blood pressuring against the walls of the arteries is too strong. Arteries are blood vessels that carry blood from your heart throughout your body. Hypertension forces the heart to work harder, to pump blood, and may cause the arteries to become narrow and stiff. So the blood pressure has ranges. If you've seen the blood pressure results, you see there's a top line and there's a bottom one. So the top line is called the systolic and the bottom one is called the diastolic. So the systolic one, it measures the pressure of your arteries as your heart beats. Yet the diastolic, it measures the pressure of your arteries as your heart relaxes. So if you can hear your heart, it goes beep, 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 beep. So the first is when your heart beats and the other is when your heart relaxes. So what is the normal blood pressure? So the normal blood pressure should be the systolic 120 and the diastolic 80. So when your blood pressure, so you've got 4 stages of the blood pressure results. So when the first one is now abnormal, is elevated rather, the systolic will be between 120 129, then diastolic will still remain 80. It depends. Sometimes it's conditional. Maybe you've been running, maybe you've been angry, and then it will become elevated. And most of the time, sisters and doctors don't give you treatment at this level. They ask you to come back for monitoring. And then hypertension stage 1 now is when the systolic is 130 to 139 and diastolic is 80 to 89. And the second stage, which is now high, very high, is the systolic pressure will be 140 or above, and the diastolic now at 90 or above. So when do you contact a healthcare provider? If you think you are having a reaction to medicines you have taken, you have repeated headaches, and then you feel dizzy, you have got swelling on your ankles, and you have trouble with your vision, then you might want to consult a healthcare professional. But when do you need to get help right away? When does it become an emergency for you to get help? When you develop severe headaches or confusion, when now you have unusual weakness or numbness, or you feel faint rather, and then you have severe pain in your chest or abdomen, then you vomit repeatedly, you have trouble breathing, these symptoms may be an emergency, so you need to get help as soon as possible. Do not waste time and do not wait for the symptoms to go away. Just get to the hospital, and please note, do not drive yourself. So somebody will ask, then how can hypertension or high blood pressure affect me? So managing your hypertension is very important over time. Hypertension can damage the arteries and decrease blood flow to parts of your body, including your brain, your heart, and your kidneys. Having untreated hypertension or uncontrolled hypertension can lead to you having a heart attack, to you having a stroke, a weakened blood vessel, kidney damage as well, which is a very critical one, and also a heart failure, eye damage, memory and concentration problems, vascular dementia. So blood pressure has dire complications. So it is important that when you think you've got signs of hypertension, or your family member might have signs of hypertension, you get them help as soon as possible. I hope you enjoyed this education session. Have a beautiful Wednesday Wellness Day. Bye.